You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. This is a special edition. We're talking about hormone optimization, what you need to know if you're considering hormone replacement therapy. With us, we have an expert on the topic, Dr. Mihnea Dumitrescu. Dr. D, welcome to the program.
Thank you, and congratulations on passing your first test, my name.
Yeah, the tough one. But your patients call you Dr. D, is that right?
Dr. D, yes.
Okay, good. Now, for people that don't know Wellcore, I guess your title is Chief Medical Officer.
That's correct.
So who's the typical patient that you see there?
I think for women, our typical patient are both women who are just going through menopause or are in the perimenopausal period, and also women who have gone through menopause. They're in their 50s, 60s, 70s or more.
So the perimenopause, like what are those symptoms? Like a woman's watching this, what does that mean?
Perimenopause, the periods start being irregular. People have brain fog. They start having hot flashes, the night sweats, depression maybe. It's a constellation of symptoms that are just frankly terrible. They cannot lose weight anymore, or they're gaining weight, maintaining the same amount of calories that they usually eat. So basically women lose their sex drive. They've been married, they look at their husband and they just don't feel anything anymore, right? And then you have the women who are postmenopausal, who have basically not had periods in a year or so.
Okay. What's the age range of these women in menopause?
Usually late 40s, early 50s.
Okay.
Yeah. And these women have not had periods for a year or longer, and their symptoms are pretty much the same like the ones we talked about, only amplified. They have night sweats, they have hot flashes, they're depressed, they gain weight, they have no sex drive. Basically, they become a pleasure to live with.
Now, do you see reversals in these symptoms?
Absolutely.
Once they get on the program and if everything goes right?
Absolutely. Yes. The effects of the combined dance of hormones that we do are essentially reversal of all the postmenopausal symptoms and perimenopausal symptoms, of course.
Okay, now what about men?
Okay, men, generally men are in the same age range when they come to us, but men are a little different because men need energy, right? So what men come to us telling us is, I lost my energy, I lost my drive. So the symptoms are not very dissimilar to women's symptoms. They gain weight, they have loss of libido. Men may complain of hair loss or again, gaining weight, but essentially the loss of drive and the energy loss is what brings them in.
Now you have a unique system, okay? I guess typically you'd have to go to a center. You have a telemedicine-based model.
That's
where
right.
Everything is done on Zoom.
That's right.
Is this HIPAA-compliant?
Yes, we have a HIPAA-compliant telemedicine platform, and all our messaging and our Zoom and our clinical staff are HIPAA-compliant, and they are there to offer this high-end experience to our clients because Wellcore is about a high-end experience. We wouldn't want to do this any other way.
So take me through the process. Somebody's watching this, a woman, she knows a little bit about bioidentical hormones, or as you call it, hormone optimization.
Yes.
Or a man. How do they get started? What's that process like?
They contact us either on website or through a phone call. They get assigned a team member.
Okay.
Once they decide that they're going to go forward with our process, we send them an at-home device, and they do all the blood collection, everything at home.
All right.
They send the device in the mail. It takes usually about 7 to 10 days. Once we have the results of these blood draws that we do, and we assess a number of tests. We don't just assess a very small number of tests like some of our competitors. Once we have these tests, we have a telemedicine call or a HIPAA-compliant Zoom call with
one of the doctors.
Well, one of the doctors,
okay,
or one of the practitioners that are all Wellcore trained. During this Zoom call, we talk about the tests, we talk about their symptoms, we do a pretty thorough assessment of their family history, medical history, and all that. And if we decide together that they're a candidate for a program, then we write the prescriptions right then and there. We send them to our compounding pharmacies. They get them within a week or two, and then they start administering the hormones.
Okay, now your program, if I get this, it's $99 to start. Works out to be about $225 a month.
That's correct.
And it includes some of the hormones as well.
Exactly.
So it's an all-inclusive program.
It's an all-inclusive program.
Okay.
We don't have any hidden costs. We don't charge people for anything extra. The $90 initial fee includes the first assessment with our physicians.
Okay, so they start with the hormone optimization.
Yes.
What happens next?
Well, we reassess every 3 months. Every 3 months, they are sent another kit, another blood collection, at-home blood collection device. And we have these quarterly appointments or quarterly Zoom meetings where we talk about how they feel. We assess our results. We look at the symptoms and we look at the numbers, because there's got to be a correlation between symptoms and numbers. We don't just use numbers, we don't just use symptoms. There's always this interplay between the two.
So every 3 months they're going to retest with some blood work.
Exactly. Look, this is tedious work, right?
Okay.
Especially for women. It's hard to optimize everything in one shot, right? Everybody's going to feel differently. Everybody's going to react differently to what we do. So we do need a period of time where every 3 months we talk to people and we reassess what we do. Maybe we change dosages. We see if they have side effects or not, etc.
So who's on the team on these telemedicine calls?
We have clinicians, and the clinicians may be physicians, MD, DOs. They may be nurse practitioners. They may be physician's assistants. And then we have a client success manager that's assigned to every patient.
Now, this telemedicine model.
Yes.
Is that why your prices, you're able to keep them low because you don't have to visit offices?
Yes, that's the main reason, obviously,
Okay.
because we're able to forego all the expenses associated with a brick and mortar place.
Now, I want to back up to the blood draw. You
Right.
love talking about this blood draw. I guess you have a special way of drawing blood that is really not like a regular needle.
That's exactly right. There is a device that you stick to the side of your arm, and it draws blood immediately from the capillaries, so it doesn't go deep. And it's whole blood, and the whole process takes about 5 minutes or so.
Now, I haven't seen them, by the way. You know, like these blood glucose monitors, you just push it
Right.
in. And
That's
it's very similar?
very similar. Only it has a little collection device where
Does
you
it
collect.
take enough blood to get?
Yes, yes. I mean, sometimes you need 2 of them,
Okay.
right? Depending on how much blood we have to take, and this is why it's been taking us 2 years to perfect this, because we talked to the company who makes the devices, and we had to actually readjust all the parameters, and we had to agree on what kind of blood tests we're going to do, and all that. So it's been a very long process, but we're very proud of our product.
And what hormones and what are you looking at on this blood work?
Well, it depends. For women and for men is a little different, but we usually have whole hormone panels, and then we look at lipids, we look at thyroid function tests, we look at liver, we look at kidneys. So it's a pretty comprehensive panel.
Okay,
actually.
good. I've had Bosley on the show, the hair guys,
Absolutely,
right?
yeah.
And, we've seen their commercials. Guy gets his hair back, he's running and hiking and dating, and we've talked on the phone.
Yeah.
That seems to be what happens when they get involved in your program.
Absolutely.
Like they're back all of a sudden.
Absolutely.
I'm not trying to side with you, but is it really that much of a transformation?
Well, I think you are trying to side with me because I think you're on hormone replacement, right?
Just on testosterone.
Well, just on testosterone. That's good. That's
okay,
fantastic.
a little thyroid too. Okay, that's it.
That's great. Yeah.
But is it really? I mean, do you see the patients where for some people it's just a big deal with energy and libido and everything else?
We were just talking with a gentleman in West Texas that's been our patient now for about 6 months, right? And he told us, I'm a better father. And we were like,
How
are you a better father? You would just put you on testosterone. And he started telling us about how his sleep has improved. And because his sleep has improved, he's got more energy and is spending all this time now with his 2 daughters, right? And, he's become a better father because of hormone replacement. We have another patient who's a home builder, right? There's a lot of home building in Texas. I'm probably sure there's some here, and he, through COVID and everything else, just like everybody else, he's slowed down. He's put on, 30, 40 pounds of extra weight, just like a lot of other people. He came in, he's a patient now. He lost the 40 pounds in about 6 months or so, right? He is on his job sites, he is thinking clearly, he's solving problems, he doesn't have the brain fog that he used to have anymore. We hear the stories all the time. We have a lady who's a teacher, right? I mean, if you think about the people who were affected through the pandemic, right?
Yeah.
teachers, nurses, some of the doctors too, although nobody talks about the doctors, but teachers and nurses. We're talking about first responders. We're talking people who are taking care of other people. So this teacher lady, she was ready to quit. She had it.
Because of what? Lack of energy,
well,
lack
it was
of concentration?
it was a COVID pandemic combined with her menopausal symptoms, and that was a double whammy for her. She was like, okay, I'm done. We put her on hormones. She's doing great. She has a new love of teaching. Her students love her. I mean, we hear these stories all the time. I sit in conferences and I hear other stories all the time, and it's inspiring, right? There are very little things. There are very few things that you can do that are so inspiring in medicine, and so it's almost like instant gratification, right? I used to put these devices under people's skin for chronic migraines, right? There were these peripheral devices that put under the skin here in the back of the head, and I saw lives change with that. People with these chronic migraines, they were just completely miserable, and you put these electrodes and they become different people. They can start eating chocolate and drink red wine. And so it's the same thing with this, the hormone replacement. There are very, very few things in medicine that give you the satisfaction, and this is one of them.
Is that right? Now, let's start with women.
Yes.
Okay. So a woman comes to you. She talks to one of your consultants or your team.
Yeah.
She decides she's going to move forward. You send the at-home test, does the blood draw,
right,
sends it out. She talks to that medical doctor. She gets the hormones.
Yeah.
How soon do they start feeling better?
So in general, most people feel better within 1 to 3 months, right?
Okay.
But when we talk feeling better, that's the subjective feeling of better, right? So they have the energy, they have the drive, they have the libido, right? They have the sleep, right? Those things come pretty fast, right? But of course, there are other things that influence how better you feel and how fast you feel better. Obviously, if you live clean and if you work out and if you eat well, you're going to feel better faster.
Okay.
And there are some benefits of hormones, like decrease in strokes, decrease in heart attacks, bone health, decrease in osteoporosis, endothelial, the blood vessel, improvement. Those take 1 or 2 years, right? Those don't take. They're not immediately.
But the blood vessels get better.
Absolutely, but you have to be on this therapy for a longer period of time to have full effects. And again, if you get off the therapy, the effects go away.
Okay, we're going to go to the men in a minute. Let's start with women. What are the commonly replaced hormones for them?
The normal hormones for women are estrogen, progesterone, DHEA, sulfate, and testosterone and thyroid.
Okay, let's start then with women and testosterone.
Sure.
Do women even have testosterone levels? And
I
is
hope
it important for them?
Yes, it's just as important for women as it is for men, actually, right? Testosterone does pretty much the same thing in women as it does for men, which is sex drive, libido, cognitive function, bone strength, cardiovascular, cognitive decline. It helps with cognitive decline. It may actually push back against Alzheimer's, because it decreases the deposition of beta amyloid in the brain. So it does for women the same things that it does for men. It is very important.
Now we've talked things like brain fog or
absolutely cognitive. Yes.
Gets better.
Absolutely, irritability gets better. Depressive symptoms get better. Anxiety gets better. I mean, balance is a big one, right? We're talking about women in balance. What causes falls, right? Falls and hip fractures, right? That half of the women who have hip fractures in their 70s never walk again. Right?
Is that right?
Absolutely. So if you talk about these hormones and the bone health combined with the improved balance, we save millions of lives by doing this.
Now, is it too late to do this at 75 years old, 85 years old?
No.
You can do it.
It's not too late at any age.
Aren't the older group of people a little more stubborn? Like, I've made it this far without it. Why should they try it?
Well,
and what could you tell them?
Well, look, I mean, the idea behind what we do is to be the best 80-year-old that you can be, and the best 70-year-old that you can be, right? We're not trying to make you into a 20-year-old if you're 80, right? But there is so much benefit that you can have at 80 years old, and why to do it? So you don't fall and break a hip and pardon my frankness, die, right?
Okay.
So I think that's a pretty good, reason to do it, I mean, even if you're not interested maybe in sex anymore, right? Although there's no reason not to, right? But there are so many other reasons to do.
Do they come in typically, like for one thing, I just want more energy, and then all of these other things that happen that they didn't expect?
That's exactly right. People don't come in and say I want stronger bones, right? I mean, no woman has come in and say, well, I mean, I'm worried about my osteoporosis, right? And guys don't come in and say, I want, I don't know, my endothelium, my carotid to get better, right?
Okay.
I mean, nobody knows about that.
They might
stuff.
come in just for libido.
They
lack
want
of
for,
sex or
generally
energy.
men come in for libido, because men are men, right? And they come in for libido and they complain of decreased sex drive and libido and the weight loss, and the men develop these internal frustrations when this happens to them. They just lose they're not sure of themselves anymore, right? They don't want to date, right? Because they're scared they're not going to be able to have sexual relations with somebody. They're scared their wives don't think about them the way they used to anymore, right? So
they tell you this on the consults.
Absolutely,
okay.
and absolutely, especially if you ask, right? Now with some men, as you know, you have to ask, and we have some people who live in rural areas that we see, especially in Texas, where there are no doctors within a 100-mile radius, right? And you have to get that out of them. But once you start talking to them, yes, they'll tell you that, and you put them on hormones and they start getting noticed, right? People start, look, I've been on hormones, right? I work out, I'm not excessively, but I'm, consistency is the key, right? And my wife and I went to Puerto Vallarta for a vacation recently, and you go there, you go to one of these resorts, you sit by the pool, you're in your swimming trunks, I have had at least a dozen men,
yeah,
right, come to me asking me what I do for my body, what I take, what I do, asking me how old I was. I used to joke and I told them I was 75 years old. They were like, no, and you're not 75. So
is your wife on hormones too?
Absolutely.
So you're both.
Yeah, I wouldn't have it any other way.
In Mexico, looking better than everybody else.
Absolutely.
But is it the energy?
Well, of course.
You just have more energy?
I mean, there's the energy, there's a certain air about you. I mean, the way you carry yourself, when you look good, you feel confident, right? It gives you confidence. It gives you the drive to maybe start that business, when you didn't want to start that business. Well, of course, right? I mean, it all stems from feeling better, right? I mean,
is this modern medicine?
This is modern medicine.
So this is kind of a gateway. They start with hormone optimization, then they automatically start to want to eat better?
That's exactly right. Because once you start feeling better, it's a virtuous cycle, right? You don't want to eat like a pig anymore if you start feeling better and you start losing weight, right? You want to keep this going. If you start sleeping well and feeling better and losing weight and your hair looks better, and for women the skin looks better, the nail look better, they don't want to go back to where they came. So you're asking about stress, you're asking about sleep, you're asking about diet,
all this goes together.
Those generally fall into place. It's really amazing, right? You don't necessarily have to give people diet plans. Most people know what to do, right? Most of us know what to do, let's face it. I mean, most of us know.
We just can't do it.
Exactly, right? So we need that extra motivation, especially in our 40s, 50s, 60s, right? When, you were told you're an old man or you're an old woman now, you have to hang out your cleats and sit on the couch and get fat now, right? Well, that's not the case. I mean, this therapy is about people, it is for people who refuse to take aging lying down, right? They don't want to they don't want to, aging is a disease, right? And aging gracefully, I have nothing against people who want to age gracefully, right? But let me tell you, when you look at it, there's not much graceful about aging and the diseases associated with it, right?
You're a pretty inspirational guy. You're the chief medical officer of Wellcore. And I think you told me on the phone, you've kind of handpicked what you think are the best of the best clinicians to deliver this message to get patients to comply with your recommendations.
That's right. And it's not easy. Right? It's not easy because you have to find people who believe in this, right? They have to buy into this in their personal lives, and as well as in their professional lives. And there's no clear pathway for a physician or a nurse practitioner or somebody to learn about this. This is something that you have to be interested in and learning from somebody else, right? I've had my own mentors, like Neil Rousier and others who have taught me a lot about this, but you have to have that interest. So you have to adopt it in your own life.
Now, for people just tuning in, we're talking about hormone optimization for women and for men. The program is about, if you don't mind me saying, $99 to start, works out to be about $225 a month.
That's correct.
They're sent a test at home, easy blood draw, send it out.
Yeah.
It's evaluated. They go, I just want to make sure I have this right. Then they talk to a doctor.
Yes.
On a HIPAA-compliant Zoom meeting.
Call. Yes.
And then every 3 months they get retested for the first year.
Yes.
And then do they have access to these doctors on the Zoom calls?
Yes.
Or the nurse practitioners or the team?
They have access to a sort of a client, success manager or a concierge, right? And through that concierge, they have access to any clinician.
So if somebody, let's say, they're taking thyroid.
Yes.
Maybe, and they're getting heart palpitations.
Right.
Can they call and
They
speak
can
to
call,
someone?
they can message us, they can email us, they can go online. I mean, they can send the carrier pigeon, they can do smoke signals. Now, we can do all of it.
Let me ask you, okay, because we're talking about estrogen and we're in a bit of a rush here, but estrogen, progesterone, thyroid, DHEA.
Yes.
Thyroid.
Yes.
We've talked about testosterone.
Very important.
What's that responsible for?
Well, thyroid is responsible for brain function, right? Metabolism, temperature regulation, right? So it's a pretty important hormone. And let me tell you, there are thyroid receptors on the sexual organs, and there are sexual hormone receptors on the thyroid. So the thyroid and the sex hormones work together.
Is that right? Okay.
People who don't optimize thyroid will not get the full benefits of the sexual hormones and the other way around. So when we started this, there was not even a question that we're going to do thyroid. I mean, it's a sine qua non.
What about weight loss? Does it help with metabolism?
Absolutely, metabolism. Absolutely, it's
and energy?
Probably the number one hormone responsible for metabolism. Energy too, related to metabolism, of course. Right.
I have questions, and I'm sorry to rush you, but progesterone in women.
The feel-good hormone, it's one of the feel-good hormones with the thyroid hormone. So the nice thing about progesterone, Randy, is you can give them to premenopausal women, perimenopausal women, postmenopausal women. Hell, you can give it to pregnant women, right? Okay. So it can be given to in all stages, right? And progesterone has this little dance with estrogen that's protective of breast tissue, right? Because unopposed estrogen can be damaging to the breast tissue. So progesterone is very, very important in breast tissue. And
so you explain to me, by the way. So estrogen, as you get older, stays up, and progesterone goes low.
Yeah, both of them go low.
Okay,
actually.
They both go low.
Yes,
and then you're kind of optimizing them back to more youthful levels?
Exactly, but you have to be careful the way you optimize it, because if you give too much of one and too little of the other, that's not going to be very good, right? So they have to be in this little tango.
So you have to adjust them throughout
the three. This is why we do the 3-month follow-ups. This is why it's tedious.
Is that why you don't like pellets necessarily?
Exactly right.
Okay.
Exactly right. And so progesterone, is good for PMS symptoms, which is great. Progesterone is great for sleep. It's an amazing sleep hormone.
Really? Okay.
Less Ambien and more progesterone.
Now, are you doing pills? Are you doing injections?
Progesterone is usually
topical creams. What is it?
Progesterone is usually a pill, although we have these vaginal inserts, Randy, that we can compound, and we can put estrogen in them, we can put testosterone in them, we can put DHEA in them, we can even put progesterone in them.
Surgically inserted?
No, no, they're not surgical inserts. They're the size of a Tic Tac. They still make Tic Tacs?
Yeah, probably.
Okay, so they're the size of a Tic Tac, that it's introduced in the vagina once a day by women, and because it has all these things together, it increases compliance. We thought about creams. Creams are messy. Creams are messy. People don't use the creams. When you put testosterone creams in the same spot, you can grow hair. And women generally don't like hair on their thighs. Okay. I don't know why. But they don't. So these little vaginal inserts work great, actually, and they're infinitely customizable, right? Because our compounding pharmacies can put whatever strength and whatever we want in them.
Tell me this, for the woman, because women, it seems like, are more in the know when it comes to hormone optimization.
Yeah.
What if they're already doing it elsewhere?
Yeah.
Why would they want to give Wellcore a try? And for men that are dabbling in testosterone replacement, why would they consider making the switch?
What I didn't tell you when you asked me about our typical patient is that we have this other category of people, which are exactly these people. They don't need any convincing because they're already on hormones, but they come to us because of the different experience that we offer. We offer a different high-end experience than where they are already, right?
Okay.
So they've heard about our devices, they've heard about our platform, about messaging and all that. So they come to us for that. They already know. They're converts already, right? So our clinical team and everything else is attractive to them.
And I mean, they must like that Zoom meeting.
Well,
instead of having to go to an office.
Exactly. I mean, the whole package, right? You know, and when I mean the whole package, I also mean the packaging, which is pretty neat, actually. I don't know if you've seen it.
I have not. So you're not cutting any corners. Like you told me, I think on the phone, you said this is not just like some low-tech clinic.
Absolutely not.
I mean, you guys are serious about this.
Yes, we won the Ferrari.
Okay.
We won the Ferrari.
And so final message, somebody watching this, maybe they've heard what you have to say. Mm-hmm. Maybe they've never tried it before. They're skeptical. They're afraid. Yes. They're afraid of it growing cancers, things like that. What do you say to them?
Well, look, there are going to be people watching this who are just going to go, they're on their laptops already going to teamwellcore.com and signing up. I know that. Okay. But there's going to be this other category of people, like you say, who are going to be, well, you know, why can't we age gracefully? This is not normal and all these things. So as far as you know, it's not normal. I don't know if you've ever been in an operating room and they do open heart surgery. There's nothing normal about that. There's nothing normal about, you know, there's a hip replacement, knee replacement and all that. And nobody says anything about that, right? That's number one. Number two, the age gracefully camp, I talked a little bit about that before. I think the Wellcore way is aging gracefully.
So you could either take advantage of modern medicine or not, like in the knee replacement or whatever.
Or you can age gracefully and see what that feels like. And you know, obviously the pricing, right? I mean, the pricing.
It is affordable. There's no doubt about it.
Absolutely, it's it's less than a personal training every month. Hell, it's less than you pay for those horrible frappuccinos at Starbucks every month. You know, they're just not doing anything good for your health anyway. So, we treat ordinary people in an extraordinary way. You know, and this has been our mantra since day one. You know, none of us wanted to get involved with something that's not the best.
Is this very unique? Like, for example, you're in the know, you're a medical doctor. Is this pretty much not a lot of people are doing it this way?
Nobody.
Nobody that you know of?
Nobody that I know of.
Well, good for you. I want to thank you for coming on the show.
Thank you for inviting me.
And like you said, so do you believe that you can just like live into your 80s and 90s with great health and then just one day it's...
Absolutely.
Rather than having that health span that's the last 10 years of your life are miserable?
And, you know, I also believe, you know, just a final thought. I know we're out of time, but, you know, people spend ungodly amounts of money these days on biohacking, right? I mean, everybody's about... you know, defying age and, you know, and fighting age and all that. This is biohacking for everybody. This is biohacking that works, right? At a price that anybody can afford. The UPS driver, the teacher, the nurse, everybody.
Good.
Everybody.
Dr. D, I want to thank you for coming to the show. Great stuff.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.